Hi, it's me. This is Hiro. So, title of my talk is Understanding a Complex Issue of Childhood Obesity. So, since our last topic in this semester was childhood obesity, and I think in our memory is still fresh in terms of this topic, I think it would be easier for you to follow. I hope. So this is my table of contents. So I'm not going to talk about everything, so don't worry about it. I will briefly talk about first two, introduction and prevalence of childhood obesity. And then I'm going to move into specific issues and current situations in Nevada. And then talk about cultural differences, specifically focus on Japan and US. Then I'm gonna give you, some idea of where Japan and US are ranked compared with other countries. Then talking about to what I guess what kind of policy Japan has. And then I will talk about conclusion and give you some I guess take home message from this presentation. All right, let's get started. Introduction. So obesity is considered, one of the most threatening and concerning public health issue worldwide. It's not just in US, it's really worldwide, as we know. And obesity has a lot of negative consequences. So just because it's related to a lot of health related issues and costs a lot, and also related to mental disorders. And also, I want to say the quality of a life will decrease once someone become obese. So we have to do something with it. So over 35% of U.S. adult is now considered as obesity. So 30, one of three people are basically considered obese. So to prevent children from being obese is one of the best way to decrease this number and to develop healthy community. For example, eating right, eating healthy food, and doing just more work, doing a lot of physical activity. One of the best way to prevent this issue. All right, next I want to talk about prevalence of childhood obesity quickly. So prevalence has been basically increasing. So 1963 only 4%, but right now 70% or in 20.7 million of children and adolescents ages from 2 to 19 years old are considered as obesity based on according to Centers for the Disease Control and Prevention in 2016. Then I think as we know that this percentage 70% is strongly affected by race, ethnicity, and social economics and educational differences, and we can also say genetics too. But for example, black children has higher as well as Hispanics, and what kind of family children have is also strongly affected. Low income family basically has higher as well as education you know education system, like whether parents have high education or low education, is also strongly affected. Okay. Or even though I say I'm going to skip actually physical activity and nutrition, I just want to briefly mention what's really important, what we should probably really know about. So when it comes to school program or something we should do to prevent children from obesity, is we have to combine two. I read this amount of articles only focus on physical activity and focus on nutrition and combination of both. And I think it's clear that if you combine two, success program are more likely to be successful. If we only conduct it using one, either physical activity or nutrition. I saw this study basically you know didn't affect anything, didn't was not successful. So as I said, key is to combine, and more than 6 months should be should be implemented. All right. Let me move on, discussing the current situation and issues in the state of Nevada regarding childhood obesity. I hope we, I guess, care about this section, since we live in Las Vegas, Nevada, Las Vegas. So at this point, Nevada is ranked on 25 highest states in US. And by the way, adult is 35 highest states. So meaning the 15 lowest states from the top. So it's not bad. It's actually great or better or good compared with other states. So but compared with adult, children rate is still higher just because it's exactly in the middle. So to give you some idea, obesity related to cancer among people in Nevada, adult, has 37,000. And as you can see, it costs a lot for people in Nevada, so we gotta do something with it. But I just wanna share with you some great news. So there are a lot of existing policies and school programs, partners for Healthy Nevada. This is one of the example, focusing on physical education and diet, healthy food, and I can see they make a lot of success over the past recent years, and that's the kind of probably one of the reasons why the rate of changes has plateaued over the last several years. So it's not increasing right now, which is good news. So, but I just want to mention two different issues that I think it should be addressed in the near future. The one is workability. So what am I talking about here? So workability and physical activity, how much we can play outside, or we can run, or we can do something outside, can be really affected by the number of available parks, city layout, and safety. So basically, according to work score, Nevada is not considered as high, so lack of desirable workability score. So that could be probably one of the issue. I mean, just based on my understanding, so it seems to me that Henderson and Summerlin has a lot of parks and a lot of nature, but I guess Nevada in general doesn't have high workability score. So that should be, I think, improved in the future to prevent obesity. So next issue is accessibility to healthy food. So even in urban area, low-income families have less access to healthy food. It doesn't say high-income families, so I'm not quite sure this is for only low-income families. And the second point, fast food everywhere. That should be, I would say, decreased. And big issue in rural and frontier countries. So to get healthy food, people need to drive, which means it costs for gas, and it takes time. Then simply fresh food is more expensive than just regular not healthy food. So that's why I think it's even difficult for lower income families to get healthy food. All right, let's move on to discussing about cultural differences. So before talking about the difference between U.S. and Japan, I just wanted to give you one study comparing 8 developed countries that include U.S. and Japan. So as you can see, Japan is ranked lowest rate of childhood obesity, and after Japan, Germany, France, England, New Zealand, Canada, and Italy will follow. So they're all developed countries based on the way this researcher concluded, mentioned. So in last year, US is ranked as highest rate of childhood obesity. So I think it's safe to say that US has really high, and we have to do something with it. Yeah, I'm going to give you some two idea, and that one of the reason probably why Japan is lowest, besides just eating small portion of meal and eating fresh or and so on. Okay. All right. So one of the reason why Japan has lowest rate of childhood obesity is we have a policy called walk to school. So in Japan, population density by country is higher than in the US, which means we don't have a lot of area per person. So I'm going to just show you the graph to explain. So this is in the population density by country. I mean, it's not high, like same as in Bangladesh, which is the top, but Japan is higher than US. Meaning that again, as I said, there are not broad acres in Japan, so we can probably easily walk to school. Just because a lot of schools are around where we live. So as I say, walk to school policy. So walking distance to school in Japan. Then I just want to sort of give you my personal experiences. So it takes 15 minutes to walk to elementary school for 6 years and 20 minutes to go to middle school for 3 years. So by using just simple mathematics, 30 minutes walking for 6 years and 40 minutes for 3 years can be counted, and then which is it's really normal for many children to walk into school or bicycle if the distance is far. So that's probably one of the kind of main reasons why we do more physical activity, and then we can prevent children from being obese. Then another one that I want to talk about is safety. So according to Institute for Economics and Peace, in 2015, so Japan is ranked number 8 in global peace index ranking, and US is ranked 94 out of 164 countries, and which is the lowest ranking among developed countries. So I think it's safe to say that in Japan it's easier for kids to play outside. It's easier for children to let their kids just go outside and then to play, and easier for us to walk outside. So that's why I think more physical activity can be expected, leading to probably reduce children from obesity and to prevent children from obesity. Alright, this is actually my last slide and conclusion and take-home message, that something I want you to remember. So as I said, so now 70% of children are obese in US, and this is strongly affected by education level, living location, and genetics, and parents' income, and parents' education system. And but many policies in US has been implementing, and the result seems successful if physical education and nutrition are combined, so going to the right direction. Then as I said, physical activity, nutrition should be combined. And in terms of issues in Nevada, I think walkability should be improved, and also it should be more easier access to healthy food for all of us. And lastly, low obesity rate country Japan. So we have walk to school policy and safety. So these are probably some of the components to help children from being obese. And besides small meat, and I think we generally eat fish, and I think we have a little bit different norm that we don't want to be even, I guess, chubby, just because people are going to kind of start judging us if that's the case. And I think in US now a lot of people are considered as obesity. So as Dr. Nabolta said, norm could be changing. It's like obesity, being obese is kind of norm, based on I guess the textbook. So in Japan we totally don't have that. We don't even want to be kind of chubby. So that's the probably reason why. All right, then, thank you so much. All right, if you have any questions, you are more than welcome to send me, I don't know, any emails or something. All right, then, thank you so much.